Today, we turn our focus to the just concluded second round of the polio vaccination exercise in Sokoto State. We are shedding light on the successes recorded, challenges encountered, and the next step towards sustaining a polio-free Sokoto. Welcome to Panorama from Sokoto Network Center. I am Sadia Umrediki. Speaker, House of Representatives Benjamin Kalu says the inauguration of the newly constructed collector of road NC12 from Arterial Road 11 by Ahmadu Bello Way in Mabushi to Judges Quarters in Katampe and other roads reflect present administration's commitment to urban development that will improve the lives of the people. This was during the inauguration of the project in Abuja. Onoze Yakubu reports.
It is a win-win situation for both the contractor and the FCT administration. A promise made and promise fulfilled. And in less than a year, this road project has been delivered and opened for motoring public. Deputy Speaker of House of Representatives Benjamin Kanu, who stood in for President Bola Tinubu, assures that his administration will continue to invest in critical infrastructure that will impact the lives of the citizenry.
We are committed, very much committed, to making sure that the ongoing and future infrastructure projects that will further enhance the quality of life for our citizens are achieved, and that's a good time.
FCT Minister Yesen Wike stressed the need for people to pay their taxes to attract more developmental projects to the city.
That's why we are very aggressive to say you cannot be enjoying this free of charge. You have to pay. We need the money to do the work that we are doing. So you have to pay. So that we can carry out the job, we carry out development.
Katampe and Mawishi districts are part of the districts in phase 2 of the Federal Capital City. Though the districts had experienced development over the years, the engineering infrastructure were yet to be provided. The contract for the road and infrastructure to Collectorate CN2 and Mabushi district to Katampe district and other roads was therefore awarded to provide the infrastructure and open up the districts for further development.
In another development, the minister inspected the newly constructed Arterial Road M5 by Obafemi Awolowo Way from Life Camp Junction connecting Ring Road 3 ahead of inauguration on Friday. Onoze Yakubu, NTA News.
First Lady Oloremi Tinubu has appealed to Nigerians to work with government in building more inclusive communities where refugees and internally displaced persons are not just welcome but truly embraced and supported. The appeal contained in her message marking this year's World Refugee Day also implores refugees once supported to reciprocate by being law-abiding and contribute meaningfully to their host community. She says the theme, Community as a Superpower, speaks to the heart of what the community can do to contribute to the most vulnerable amongst us. While noting that refugees across Nigeria and the world have shown remarkable strength, First Lady emphasized that it is often the kindness of neighbors, the open arms of strangers, and the unity of community that turns survivors into hope and hope into healing. The Mission Company of Nigeria, TCN, says it has boosted capacity of national grid with additional 5,910 MVA transformer to ensure its reliability. The General Manager Project Coordination, Aminu Tahir, reveals that this is achieved through the implementation of various donor-funded projects under the Project Management Unit of TCN. The unit is currently executing projects funded by the World Bank. Agency friends said the development AFD, and the African Development Bank, AFDB, while the procurement process for the Japan International Cooperation Agency, JICA Lagos and Ogun projects are being finalized. Several of the donor-funded projects TCN says have been completed, while others are about 80% completed. The Chief of Defense Staff, General Christopher Musa, is advocating for the whole-of-society approach as critical means to further secure the nation. The Chief of Defense Staff made the remark at a media parley with media executives at the Defense Headquarters in Abuja. Defense correspondent Ismail Musa reports.
Media executives of electronic, print and social media at a forum to strengthen understanding and build trust between the armed forces and these gatekeepers, who are members of the fourth exit of the realm. The Chief of Defense Staff, who stressed the complexity of the nation's threat environment, noted that the military is not only engaged in physical fight with terrorists and bandits, but also in a drive to win the hearts and minds of Nigerians towards a whole-of-a-society approach to insecurity.
Media is a powerful force. How the media reports on our operations have a significant impact on public perception and morale, both locally and internationally.
Whoever controls the media narrative controls the public sentiment. Do not grant our adversary the advantage by prioritizing sensationalism over national security.
Within the period under review, new combat enablers and platforms were acquired, upscaling the fight against criminality across different theaters of operation.
The number of terrorists killed is 6,260, while those terrorists arrested are 14,148. The total kidnapped victims rescued are 5,365.
Issues regarding surrendered terrorists, border management, informants, and the nation's criminal justice system were highlighted during the interactive session. In Abuja, Ismail Musa, NTA News.
Continues after these messages. Do stay with us.
From the Atlantic across the savannah to the Sahara, we rise, a land of the free, we know they tire. We dream great, our spirit is undying.
Resilient, rooted like palm tree, we sway in colors, we turn dark into light, we make solutions, we ignite passion, yeah. Ethnicity is unique, we are more than just a nation. We are Nigeria, strengthening unity, we know they carry lives. We are Nigeria, together live the dream of a land with great destiny. We are Nigeria.
I am the real Nigerian. Brought to you by the National Orientation Agency, NOA.
Yes. 1,385,866 children have so far been vaccinated in the just concluded second round of polio immunization in Sokoto State. The State Commissioner of Health, Dr. Faruk Umar Abakar, made the disclosure while commenting on the exercise. Alhatu Abdullahi has more on the report.
Despite cases of rejection in some local government areas, the second round of polio vaccination in Sokoto State was a success. Due to poor immunization coverage, Shagari local government area was chosen for the flag off of the exercise. Over 1.6 million doses of the vaccines were distributed across the 23 local government areas of the state to ensure coverage of eligible children. Commissioner for Health, Sokoto State, Dr. Faruk Umar Abubakar, commended the active participation of local government officials, community and religious leaders for ensuring effective advocacy across the state.
The Excellency has directed active participation of all the local government channel councillors, including their spouse. I think I want to acknowledge even the Sokoto South, his wife and all other councillors were also actively participated in this exercise.
A visit to some wards in Sokoto South local government area shows parents presenting their children to the vaccinators for immunization against polio. 2,678 teams were recruited for the immunization program, which targets more than 11,000 settlements. In Sokoto, Dalhatu Abdullahi, NTA News.
And now to our discussion segments. With me in the studio is Director Health Services, Sesa University of Medical Science and Technology, Sokoto, Comrade Balagadanga. Sir, you're welcome.
Thank you very much. It's my pleasure.
All right, sir. We want to reflect on the second round of polio. So why do you think Sokoto needed a second round, and how was the public response?
Well, yes, actually, Sokoto State needs second round because of the virus which maybe is circulating, which we want it to be eradicated, because the polio virus type 2, which actually is harassing people in the sense that it is a disease which can be communicated easily through poor sanitation, open defecation, contaminated water or food. So that is why it's very good for us to have a second round so that it can be eradicated. That's one. Then two, we also need second round because there are a lot of rejections from almost across the 23 local government areas of Sokoto State. So there are so many wards in which this immunization was rejected by certain communities. So that is why we want second round, so that we can go and talk to people, and maybe that second round can cover almost all the 23 local government areas.
So why do you think did we have rejections, and how can we tackle those rejections?
Well, being a member of non-compliance rapid response team, actually some people do complain, number one, about the safety of the vaccine. That the vaccine is not safe for them, maybe because of the potential risk of the vaccines, and not an issue of efficacy of it. Then number two, some people just will tell you that they don't like it. That's all.
So what will you tell them now about?
Yes, you know, in the rapid response team, we normally is a team whereby it consists of a health personnel, a traditional leader, religious leader, and some other people, female, you know. So normally, depending on their complaint. But if it is based on religious ground, we have a man there. So he can enlighten the person that, no, Islam does not forbid this type of immunization. Then if it is in terms of health, then it can be explained that it is hazardous because one child can infect almost a lot of children around that community. So if we have one child in that community, so it means all other children are at risk of contacting that problem. So depending on what they say, some are even saying the vaccine, they don't know where they are manufacturing it. Some, if you go, they will tell you, we have not eaten, and now you have come with vaccine. You know, so all these things are things which we normally encounter. But then, if with the moment we talk to them, they will allow us to give the vaccine carrier is there, and the health personnel is there, so it will be given, the child will be marked, and we go ahead to, because we go from one house to another. Yes, and it's across the 23 local government areas, because each ward, we have 244 wards. So each ward, there is a team. That team will be going around and from one house to another.
So how can we best reach areas and high-risk areas to cover the vaccine?
Well, high-risk areas or hard-to-reach areas, more especially in terms of insecurity.
Yes.
You see, people are being trained. The people around that place, the health workers, the community leaders, they are trained. They know their community, so they know how they can go from one place to another. So that is why it's people who are stationed in that, particular local government areas. Those are the people who will be going around to give the immunization to people. So we don't need some people coming from one local government to another local government. No. Sabonburin local government is a local government. We all know that they are suffering from insecurity. But their people are trying because a lot of children have been vaccinated. Yes, because they know the trend of their community.
Yes. From what you have observed, how would you rate this second round of vaccination?
Well, I think it's very, very successful because I think this is the first time that we have plenty of children being vaccinated. Maybe because of the commitment of the Honorable Commissioner of Health and other stakeholders. So that is why we have a very successful vaccination this time around. So actually it is very, very successful.
So what message do you have for parents who are still hesitating to vaccinate their kids?
Well, the message I have is that vaccine, they are safe and they are meant to protect our children. And once our community, once we have a pre-polio community, it means our children now will be very safe. They will not actually encounter some complications like paralysis or even death. So that is the message that everyone should bring his child for that immunization. It's house to house. Go to your house, meet you in your house, and it will be given, and it's free. Nobody is asking you to pay a single kobo. So that is the message. So let our state at least be polio-free.
So I want you to emphasize on how important it is to cover and follow up on these missed cases of the campaign of the vaccine.
Yes, to cover or to top up this immunization is that, number one, people, they have to take their children to the nearest health facility for routine immunization. Once they are taking their children for routine immunization, that's all. Because, as I've said, in each and every 244 wards, we have health facilities. In some wards, they have more than 2, 3, 4 facilities. So it's easier for people to visit such facilities for routine immunizations. When they are done with routine immunization, our child will be safe. Not only polio, but all other communicable diseases which are killing our children, especially under 5 children, because Nigeria, we are experiencing a high rate of child mortality, infant mortality, child mortality, because they are not taking their children to nearest health facility for immunization. So that is why we are having such problem.
So what areas should Sokoto focus on to maintain its polio-free status going forward?
Yeah, it's easy. Number one, engagement of traditional and religious leaders. Then number two, there should be commitment of partners, commitment from local government level. Of each and every word, there must be commitment from people. Then, apart from that, we need also to have a good health personnel. Those personnel who goes from one house to another. Because if actually they are representing the state, so once, if they are not arrogant, they shouldn't be arrogant, because people, you need to explain to them, this is vaccine and it will help protect your children, and not only your own children but other neighbors' children also are being protected once they are given this polio vaccine. So once we have this, and maybe media too can help. Yes, because there is need for media to be telling people or to be engaging certain people, so that the general public can be enlightened on the advantages of this vaccination which have been given to our children free of charge.
Thank you very much, sir, for coming on Panorama this afternoon.
You are welcome.
All right. So that was the Director Health Services, Saisa University of Medical Science and Technology, Sokoto State, Comrade Bala Gadanga. And moving on, the Sokoto State government has reiterated its commitment in partnering with individuals and groups in driving developmental initiatives that will uplift the quality of lives of people in the state. This came to the fore at the flag-off of the distribution of teaching and learning materials to selected integrated Quranic schools. Alata Abdullahi has more.
This distribution marks another crucial step in enhancing foundational learning in integrated Quranic schools in Sokoto State by supporting teaching, improving learning outcomes, and helping in bridging the gap between formal and informal education systems. This is against the background that revamping education is one of the components of Governor Ahmed Aliyu 9-point SMART agenda.
I urge you to make the best use of these materials. Let us work together to ensure that no child is left behind in the pursuit of literacy, empowerment, and opportunity for all.
UNICEF representatives stated that the distribution aims to boost access, retention, and improve the quality of education across the state.
In Sokoto State, there's a large gap in learning, especially in our non-formal sector, which is the IQS sector. UNICEF is supporting 100 IQS with learning materials, amongst other programs we're running in the IQS centers.
Items distributed to the 50 benefiting schools are whiteboards, permanent and temporary markers, long mats, pencils, sharpeners, dusters, cardboard papers, among other essential teaching and learning materials. In Sokoto, Dalhatu Abdullahi, NTA News.
The Sokoto State government is charting a bold new course in the education sector, transforming science classrooms with essential tools designed to bridge the gap between theory and practical. In a landmark initiative, the government has procured modern equipment and materials worth millions of naira for schools under the Ministry of Science and Technology across the state. Abdullahi Umar Ilalu has more.
Revitalizing education remains a top priority in the Sokoto State Governor's 9-point SMART agenda, and the results are already beginning to take shape. In its drive to transform the education sector, the state government is renovating schools, upgrading infrastructure, and providing essential materials to improve teaching and learning standards. As part of this bold intervention, schools under the Ministry of Science and Technology have received science tools worth millions of naira, a major step towards bridging the gap between theoretical knowledge and practical application. The initiative aims to empower students with the skills and exposure needed to thrive in various fields and become self-reliant after graduation.
I want to appeal to beneficiary schools, the principals and staff that are going to handle this equipment, to handle them with all the care and patriotism required, so that they will make the best use of these materials and equipment for the good of our students and education in the state.
In addition to boosting science and technology education, the state government has also prioritized the health and safety of students. To this end, medical supplies covering a range of common ailments have been procured and distributed to schools under the ministry's supervision.
We hope you will properly guard these drugs and other equipment provided for the benefit of our students in our school.
The distribution of educational equipment and medical supplies underscores the state government's commitment to enhancing the quality of education while safeguarding the health and well-being of students. From Sokoto, Abdullah Omar Ilalu, NTA News.
Let's join Olamide Obuntola on sports updates for stories trending in the sporting world.
The 2025 African Men's Sevens Rugby Tournament kicks off Saturday in Mauritius. 12 nations, including Nigeria, will be vying for honors as Zimbabwe and Tunisia will lock horns in the opening match. In football, Nigerian Super Falcons are expected to conclude their domestic training camp at the Remo Sports Institute, Ogun State, Friday, ahead of the 2025 Women African Cup of Nations in Morocco. The Falcons are expected to jet out of the country on Saturday to Lisbon for an international friendly match against the Portuguese female national team on the 23rd of June 2025. The team will then proceed to Morocco for final phase of preparations with another friendly encounter with arch-rivals, the Black Queens of Ghana. Nigeria's opening game is against Tunisia on the 6th of July 2025. From the ongoing FIFA Club World Cup, Friday fixtures indicate that PSG will take on Botafogo, Benfica will trade tackles with Auckland City FC, Flamengo will confront Chelsea, while Los Angeles FC will do battle with Esperance. In beach volleyball, National Beach Volleyball coach Kayode Ajilore has expressed confidence in Team Nigeria ahead of the African Continental Beach Volleyball Tournament scheduled for the 23rd of June 2025 in Morocco. He affirmed that the team has the qualities to make it to the podium after watching proceedings at the team's camp in Kaduna for the past 3 weeks. And finally, in tennis, world number 2 Carlos Alcaraz avoided a huge upset against fellow Spaniard Jami Muna. He came from 4-2 down to record a 6-4, 6-7, 7-9, 7-5 victory to advance into the Queen's Club quarterfinals. With Sports Update, Olumide Eguntola, NTA News.
On Panorama from Sokoto Network Center. Good afternoon.